My name's Andrew Wright. I recently gave grand rounds, or at least part of grand rounds, on wellness for surgeons here at the University of Washington. This came up yesterday on Twitter and issues of ergonomics specifically for surgeons. So I thought it'd be useful to record my talk from a few months ago so that we could share it. This is really about the physical aspects of wellness. Obviously, there are also a lot of other aspects of wellness, including things like your mental well-being, burnout, stress, etc. But today we're just talking about physical. Fix my screen here. This is a talk that had a lot of personal relevance to me for a number of reasons. So I'm about 15 years into my career as a surgeon. So through that 15 years, I've had a number of physical issues that have impacted my ability to care for my patients. And it's led me to really carefully think about my own physical well-being as a surgeon. This on the left is a picture of me just after completing chemotherapy for testicular cancer. In the middle here, I've recently been battling some epicondylitis, tennis elbow, due to operating too much. And on the right, this is actually a foot injury I had from playing soccer. So all aspects of your personal life, your health, your sports, your work and overuse injuries, they can all impact your own personal physical wellness. And that wellness then goes on to impact your ability to care for your patients. When I injured my foot, I went to see one of my colleagues in sports medicine, and he said he was going to treat me like a high-performance athlete. That was immensely flattering because I'm not a high-performance athlete. But I think it really highlights the fact that a surgeon is, in many degrees, an athlete. It requires mental acuity, situational awareness, and then the physical dexterity and skill. And we have to treat our bodies like an athlete treats our body. No athlete would go without sleep. No athlete would go without training. And yet these are things that we do all the time. You have to have the proper equipment, the proper setup. So that peak physical performance, just like our peak mental performance, is really critical to our job. Contrasting the surgeon as an athlete is the surgeon as a manual laborer. We think of ourselves as well-trained intellectual workers, but a lot of what we do really is manual labor. It's physically arduous. There's long periods of ergonomic strain. We work in a harsh environment. The operating room is cold. The floors are hard. We're standing in an uncomfortable position. And we focus so much on the patient and the operation that we don't pay attention to ourselves. And I know I fall into that trap all the time. I get so focused in on what I'm doing, the technical aspects, the mental aspects, that I forget to pay attention to my own body. And that, I think, leads to a high risk of overuse injury. It's interesting, we, because we're professionals, often don't think of ourselves as laborers. But if you were an OSHA inspector and you came in and looked at how we stand, at the equipment that we use, an OSHA inspector would actually have a terrible time dealing with us as surgeons because we really don't follow any of the best practices. And if a factory worker on the factory floor had to work like we do, there would be grounds for an OSHA complaint. All of that leads to surgeons being in pain. Lots of studies, we don't need to go into every one of them, but this is just a meta-analysis that I think is interesting. And it basically says that about half of surgeons have some element of back pain, about half have neck pain, and a lot have arm or shoulder pain. So a lot of us deal with this. And you can even go in further. This is a survey. Up to 90% of surgeons have work-related pain within the last 7 days. And 40% were currently in pain at the time they did the survey. Further on, about a quarter, just less than a quarter of surgeons have looked for professional help for their pain, whether it's physical therapy, massage therapy, seeing a physician. 15%, almost 15% have thought about leaving the profession, have missed work, and about 4%, 4 or 5% have either missed work or had long-term disability. I think this is really critical because it's not just an individual issue. of the surgeon being in pain, but it's actually a workforce issue. That if you have surgeons missing work, going on disability, leaving their profession early, that really impacts our health system as well as the individual. Of those who sustain a workplace injury, only a relatively small number actually report that to the institution. That's actually important because if you're an employed physician in particular, a workplace injury could, if you report it, actually helps protect you from a workman's comp and L&I labor and industry standpoint, and might be able to help protect your salary should you become disabled. If you don't report that workplace injury, you can actually then lose your rights to any compensation or support. Of those that have a workplace injury, a substantial number have had to reduce their clinical output or even missed work. The physical injury also creates moral injury. And there's been a lot of discussion, we don't have time for today, talking about burnout as moral injury. But in fact, the work-related physical discomfort leads to lower satisfaction, higher burnout, higher depersonalization, all of the elements of moral injury. So it's not just the physical affects the mental, and it affects the overall well-being. And I think this is a really great quote on moral injury, and that the agony of being constantly locked in double binds when every choice one makes yields a compromised outcome, and each decision contravenes the reason for years of sacrifice. And the double bind when it comes to physical aspects is that you are sacrificing your own physical comfort in order to help the patient. And that is that double bind. Are you helping the patient or do you help yourself? And so that leads to burnout. The whole goal of this talk is not just to be doom and gloom, however, it's to say that if we are conscious of this, and if we're conscious of the ergonomic challenges, then we can make changes that support ourselves as surgeons, allow us to help our patients better, and that actually then reduces that risk, not only of physical injury, but also moral injury, and makes us happier, more productive, and better able to care for our patients. I sort of have gone over most of these things about quality and performance concerns, but all of this isn't just about the surgeon. Again, it does impact the surgical healthcare system. And I think that's really important. So for folks in leadership that might be looking at this talk, supporting wellness for your surgeons will actually pay dividends for the institution in the long run. So let's get into some of the nitty-gritty on surgeon ergonomics. The first thing to say is I'm not actually an expert in ergonomics, so I would say I'm an enthusiastic amateur. There are a lot of great studies and papers, and so if this is something that you're interested in, I would highly recommend reading some of these, and I put some of the references here on screen. But as surgeons, the big risk factors, we use force and torques that are often at unusual or difficult angles and postures. Our motions are repetitive. We may have static postures. My elbow tendonitis, for example, is in my left arm, which is my static retraction arm in laparoscopy. It's not actually in the arm that's moving all the time, my right hand. We are exposed to cold, we're exposed to vibration. It turns out actually noise is a factor. The OR often exceeds OSHA noise handling requirements. Posture, I think, is a big one. And I know for myself, this is one of my biggest issues. This is just a picture of one of my residents, and you see that he's leaning forward, his neck is forward. So every degree that you tilt your neck forward, your head forward, puts a lot of weight on your neck and your back. So the posture, when you're leaning over the patient, when you have a slight twist to your body, all of that adds to additional strain on your musculoskeletal system. This is just sort of a schematic that you can see when you're really extreme bending over the patient, you can really do a lot of damage. So again, it's those asymmetric loads, oftentimes twisting your body, using foot pedals. This is a big one again for me personally, because I use a foot pedal in a lot of what I do, which means that I have to load all of my weight in my left foot and stand off axis so that I can then control something with my foot. The table height, and then of course, one thing we can't really control is patient factors. One of the issues with the obesity epidemic is that patients are now so big that even when you drop the table to their lowest height, often that's not low enough, and that's a real issue. Tool design is a major factor, and this is just an example. So these are two of the scissors in my set, and you can see these hard, rigid metal. They don't conform, they're not ergonomic. Compare that to these craft scissors that I have, and you can see nice ergonomic handle. They come at an angle, they have padding, they're much more comfortable, and they come in multiple sizes so that you can pick the size grip that suits you the best. So we in surgery have to accommodate ourselves to a static tool design, and we can't choose handles that are more ergonomically comfortable for ourselves. This becomes a real factor when you talk about glove and hand size. So if you look in laparoscopic surgery, if you have a glove size below 7, your risk of having a significant pain skyrockets. So really highlighting the impact of the importance of tool design and making tool design accommodating more people. It turns out it's not just about the glove size, it's also a gender issue. Women not only tend to have smaller hands, but even among surgeons with the same size gloves, women tend to have more ergonomic pain. And it probably has to do with other skeletal issues besides just the glove size, but it has to do with the way you stand and the relative torso length and arm length. This is just an example of that data that suggests that it's, again, if your glove size is smaller, you're going to have a higher risk of pain. But even among people with a glove size 5.5 to 6.5, women still have more pain than men. And that's because I think the default setup for years has been the male surgeon. And our surgical ergonomics haven't caught up with the fact that women now make up an increasing size of our workforce. We discussed this a bit on Twitter yesterday. One of the things I think is especially relevant here is that not only is the default surgeon sort of assumed to be the male phenotype, but actually industry tends to hire consultants who are male. And if industry only hires consultants that are male, they're only going to produce instruments that suit the male body. So it's very important for industry to start hiring diverse consultants so that the tools that they produce will be effective for a diverse population. One of my favorite quotes about laparoscopy is a way of exchanging patient's pain for the surgeon's pain. And it's very clear that laparoscopy actually increases ergonomic challenge on the surgeon, especially when it comes to back, shoulder, or even leg pain. So this is odds ratio. So basically every type of pain, the odds ratio goes up in laparoscopic surgery compared to open surgery. I don't personally use loops. However, wearing loops increases cervical load, and that's because when you, if you adjust your loops, you tend to incline your head forward. So you really want to have your loops adjusted to support a good posture. Lead apron puts a huge amount of weight, and we don't have time in this talk, but fluoroscopy and radiation exposure is a big issue. It's not just the weight of the lead, but it's also exposure as well. So all of those are the negatives. What are some of the best practices that we can follow in the operating room to protect ourselves? There are a lot of them. I would highly recommend, this is a nice review, this Ergonomics in Surgery by Catanzarite et al. So I can't go through all of these recommendations, but there's a lot of recommendations here which are, I think, very, very helpful. I'm going to highlight a few of them specifically around laparoscopic surgery again, because that's what I do. So the first thing again is to have that upright posture. You don't want your head tilting forward. You want about a 90-degree or thereabout angle, and you want the operating room table adjusted appropriately. One of the biggest things that I see is people's screen is put too high. So you want that screen about 15 degrees below your vision. And that's the optimal height to allow you to keep your neck stacked without tilting too far up or too far down. I see these display screens often set so that you have to turn your head, You have to look down, you have to look up. So you really want it directly in line with your body and about 15 degrees down. If you do use a foot pedal, you want to try to align it with your foot. That seems like it should be an obvious thing, but oftentimes the base of the operating table creates an issue with where you put the foot pedal. So if possible, try to use hand controls. And if you have to use a foot pedal, try to set up your table so that the base of the table isn't going to interfere with where your foot pedal is. A frequent thing that I see in laparoscopic surgery is that if your ports are too far apart, your arms start to wing outward. So you end up operating in this position. That's incredibly fatiguing on the shoulders. So what you want to do is place your ports in a way such that you can bring your elbows down and tuck your elbows in as close to your body as possible. That allows the shoulders to drop. So I often actually put my ports closer together on the torso for laparoscopic surgery than many people recommend, because I find that allows me to bring my elbows in tighter. Sometimes that reduces a little bit of the triangulation that we want in laparoscopy, but I give up a little bit of that triangulation in exchange for a more comfortable ergonomic position. Again, some of the common errors is tilting your head too far forward, holding your arm up at an uncomfortable level, again, keeping in mind that you want your table down low enough so that you can drop your shoulder and tuck your elbow in, and then you want your arm, here's 90 degrees, you want it between 90 and 120 degrees, so somewhere in that angle. And that asymmetry and load bearing, again, especially with foot pedals where you're putting all of your weight on one leg or the other. In open surgery, a big issue often is twisted torso. So especially, for example, working in the pelvis, very common to have to twist and lean forward. And that in particular is pretty bad. In laparoscopic surgery, that again, that common error of putting the monitor too high or to have your arms abducted, adducted. So I had to take a quick break there and run down and actually do a case. So I apologize for the little break in the talk there. Speaking of breaks, I do want to talk about micro breaks. I think these are really essential to keeping your body in good condition. We hear all the time about surgeons that do these heroic long operations and don't take breaks. It's sort of legendary. The surgeons have to be able to stand, not eat, do an 8-hour case and be really heroic. In fact, it turns out if you operate for that long, you actually impair your ability to be a good surgeon. Taking micro breaks through a longer operation actually helps restore your ability to be effective. This was really research done out of the Mayo Clinic, and I think this is fantastic. Really good evidence-based research that shows that doing standardized stretching programs about every half hour, 45 minutes during the operation improves your mental focus and actually improves your physical performance. People worry, oh, if we take a break, if we pause the operating room, it's going to be expensive. It's going to make the case take longer and make everything drag on. In fact, what they showed in their research is that taking these micro pauses doesn't actually increase overtime. And the reason for that is that even if you take that 1.5, 2-minute break every so often, you are actually improving your physical abilities and your performance more than enough to make up for those short breaks. So what do those breaks look like? So this is just an example.
Pinch your shoulder blades together as you return your hands to your chest. Turn your hands over with your palms facing away from your body and repeat the forward reach, following with your shoulders.
So you can see the kind of exercises that this goes through. It works on your neck, your arms, your trunk, and your legs. So all of these exercises can actually be done while scrubbed. So you don't have to break scrub. You can just take a break, stretch out, and it really actually helps out a lot. So let's go back to my slides here. So what's that evidence look like? We can see a 70% reduction in neck pain, reduction in wrist, shoulder, back, even down to leg and knee pain. So really remarkable. And if you had any intervention that was low cost or even no cost, and had a 70% reduction in pain, we would instantly jump on that for our patients, but yet we don't take care of ourselves in the same fashion. It can be hard to remember to take these breaks. And so one of the nice things, there's actually an app you can use that's available through their OR Stretch website. And you can actually set a timer that reminds you every 30 or 40 minutes, and it will actually walk you through those exercises. What about robotic surgery? You hear a lot of surgeons talking about how the big benefit of robotic surgery is actually improved ergonomics. Interestingly, there are actually some randomized control trial that shows no difference in physical pain among surgeons with robotic surgery. What changes is the type of pain. So people have less back and shoulder pain, but perhaps more wrist and hand pain and neck strain because your head is forward into the console. I actually have started using the robot myself to protect my elbow. And I found that it helps my elbow, but I do have some more neck strain using robotic surgery than before. There are a lot of guidelines about the ergonomics of robotic surgery involving the setup and the setup of the console so that it's ergonomically comfortable. The biggest thing is actually how the head is arranged so you're not too far forward with your neck. You want the arms perpendicular to the floor. One thing I have found, our operating room does not have stools that have a lockable wheel. So if I'm in the right position, over time, my body starts backing up and I start to get less and less comfortable. I actually will put a towel or a blanket behind the wheels of my stool to keep my stool from moving since I don't have lockable wheels. The other thing about robotic surgery, we talk about the ABCs are always be clutching. It's very easy to get your hands in weird ergonomic arrangements. So you always want to clutch to bring your hands down, rest your forearms on the armrest. I do personally like anti-fatigue mats, the pink pads. I think that these get a sort of a bad name because at least in ROR, these have gotten the nickname of princess pads, and it implies that anybody that asks for them is somehow a prima donna or asking for too much. But they're actually mandated by some industries. They're recommended by OSHA. They decrease foot and back pain, and it increases energy level. So they're not that expensive. And if I'm going to do a long open case, I ask for these anti-fatigue mats. Compression stockings actually help a lot. It's remarkable how my leg pain got better after I started wearing compression stockings. One of the things, I think a lot of compression socks look pretty ugly. So it's really nice. You can find some good ones. I personally like these compression socks from Vim and Vigor, but I also recommend finding your local store. So in Seattle, the Sock Monster is actually a local store that has some really nice compression socks, and they actually offer a discount to healthcare workers. So you think you can actually check them out online and even order online from them. So how can we prevent injury? So we've talked about ergonomics, but there's a lot of stuff that we can do as well around protecting our bodies. Personally, I used to do a lot of yoga. What I found is that yoga was fantastic for meditation and mindfulness and was really helpful from those mental aspects. But really switching to Pilates, for me at least, has really improved my core stability. And that core stability is really the foundation that underlies the rest of the body. It keeps your neck upright, keeps your shoulders back, tucks your core and your pelvis in, and gives you the stability that you need, as well as the sort of more stretching that you get from a yoga style exercise. Whether you do yoga, whether you do Pilates, strength training, you can really find anything that you want, but the data is really clear that regular exercise improves your own musculoskeletal health and reduces the risk of injury. I like this one in particular. On the left, the University of Washington Department of Surgery actually has a Peloton group. So here's just some of the members of our Peloton crew. We regularly ride together. In addition to the core strength and stability, aerobic exercise helps. This is my daughter using our TRX system. Since we can't go to the gym in the era of COVID, it's nice to have a home setup. TRX is great because, again, it really focuses on core stability, which I think is critically important for surgeons. And the TRX system, you can hang it over a door. It only costs about $100. So it's actually a relatively inexpensive way that residents, for example, who don't have a lot of money, don't have time to go to a gym, you can do a 10 or 15-minute core stability and strengthening session on TRX pretty quickly. If you look at the guidelines for how much exercise, if you think the guideline about 150 minutes a week, only about half of surgeons are compliant with that. And more than just aerobic exercise, that strength training, that core stability is really important. So the recommendations are for 2 sessions of strength training per week. Only about a third of surgeons are compliant with that. And it's pretty clear that quality of life is higher, burnout is lower among the surgeons who get that physical exercise and activity. So avoiding burnout, a big piece of avoiding burnout is actually the physical aspects of exercise and injury prevention. I know I am guilty of not seeing a primary care doc as often as I should. Only about 2/3 of surgeons actually even have a primary care doc. And it turns out that burnout and is lower and quality of life is higher among surgeons who've seen their PCP in the last year. It's important not just for medical screening, mental health screening, and just continuity of care. So as I realized, it's been about 2 years since I've seen my own PCP. In reviewing for this talk, I actually made an appointment for next week. Insufficient sleep is rampant among surgeons, not just residents, but surgeons in practice. And actually, a third of healthcare workers are positive for a sleep disorder, whether that's shift work sleep disorder, insomnia, or just not getting enough sleep. It's very clear that increase in sleep disorder, increase in fatigue, increases burnout. So really critical to have good sleep hygiene. Don't surf Twitter right before bed, right? Use your bed for what it's meant for, not for watching television or sleep. All right, well, a quick break for me to go finish my last case of the day and a quick change of clothes. And here we are back to talk about sleep again. So we started talking a little bit about sleep hygiene. I am not a sleep hygiene expert, but I know what I do is not always the right thing to do. I mentioned avoiding screens in bed, establishing a routine, and you should even consider one of the sleep apps to monitor your sleep. I think it's important to talk about reproductive health and physical wellness for surgeons. This is a great review by Anderson and Goldman from just earlier this year. Unfortunately, women surgeons have a 3-time higher risk of fertility issues and almost double or more than double odds of pregnancy complications. There are a lot of reasons for that. Radiation, smoke, working conditions, the long hours, the nights, the standing. I think that we as a profession need to do a better job supporting our surgeons who choose to have children. And I think that we can do a lot in terms of things like standardized maternity and paternity, parental leave, and adjusting our work hours and work schedule to support pregnant coworkers. So just to sum this all up, when we talk about the physical aspect of wellness, whether it's ergonomics, whether it's maternal health, whether it's sleep, whether it's exercise, all of these things are inextricably linked with mental wellness. So with all of the concerns about surgeon burnout, surgeon fatigue, moral injury, paying attention to the physical body pays dividends when it comes to the mental well-being as well. The surgical career, it's a marathon, it's not a sprint. And because of that, you have to take care of yourself so that you can take care of your patients and your loved ones, and so that you can have a fulfilling career without pain and without burnout. So all through this, I've had my Twitter handle and my email address up on the screen. Feel free to reach out to me if you have any questions or comments. And I hope this is useful for some of you out there. Thanks. Oh, last thought. Find what works for you. I mentioned things like Pilates or yoga, but that doesn't work for everybody. So the things that work for you may not be the same that work for me. So find a routine, find something that works for you, and try to stick with it. Thanks.